Ladies and gentlemen, on behalf of the Siaw-Larbi Hospital, Kumasi, Ghana, the CEO and the entire management team, I present to you the Siaw-Larbi Hospital Donations Appeal. I'm Dr. Prosper Tettey Doe in the United Kingdom. Welcome. Please, you can contact us today or anytime on email siawlarbihospital@gmail.com or address Siaw-Larbi Hospital PO Box TA 28 Old Tafo-Kumasi-Ghana, or to mobile numbers Dr. KWABENA Siaw-Larbi 0205 661621 or 024 2844312, or to Kofi Siaw-Larbi 020 91 28775, or to Sister Konyo 0244 774101. Thank you. The Siaw-Larbi Hospital has gone through a lot and is now in need of support. It was set up on 13th of November 1979 with the name Ramsey Clinic by the late Dr. Ephraim Siaw-Larbi of blessed memory. The founder, as part of his vision of providing community-based healthcare, cited the facility at Old Tafo, which is a densely populated area in Kumasi, in Ghana. The clinic was being operated in a rented facility in Old Tafo, a suburb of Kumasi, and it attained the status of a hospital in 1998 and currently is situated at Mile 4, adjacent the Osei Senior High School at Old Tafo in a modern edifice.
Siaw-Larbi Hospital was set up on 13th November 1979 with the name Ramsey Clinic by the late Dr. Ephraim Siaw-Larbi of blessed memory. The founder, as part of his vision of providing community-based healthcare, cited the facility at Old Tafo, which is densely populated area. The hospital has a staff strength of 35 under the leadership of Mrs. Gertrude Siaw-Larbi.
It's been in existence for the past 39 years. Started the private practice 39 years ago. It used to be a clinic and became a hospital in 1998. We have about 35 plus workers. A hospital with 42 bed capacity, and we have come for assistance because of some problems with the investment of funds by the national insurance.
Our mission is to improve the health and well-being of our community by providing quality healthcare services with caring, compassion, and skill, so we can become a benchmark under unfavorable economic conditions. Our vision is to create a new standard for community healthcare, and with commitment to providing the most advanced healthcare with services of distinction enhancement by clinical education and good customer care.
What are some of the major cases that we get here? We get hypertensive cases, we get diabetic cases, both diabetes, both type 1 and 2, we get them. And we also get a lot of cases that are typhoid, that is enteric fever, typhoid cases, enteric fever cases. The lab is one of our problems. We are not able to get a lot of cases there, and therefore we are not able to get the money to buy the reagents, and therefore we will need a lot of money to get some of the reagents in order to be able to look after all our clients. And there are some of the cases also, we don't do the lab here. These are some of the constraints that we are facing. We have to send them out to do the lab before they come in, and then we look at the lab and then give them the treatment.
Our core values include integrity, hard work, teamwork, quality care, and professionalism.
Dr. KWABENA Siaw-Larbi, Medical Director of Siaw-Larbi Hospital. Years past, they were visiting specialists, urology, orthopedic surgery, and among other specialized services. But for some time now, we lack critical cases where people are specialized in, like the dental, ENT, urology, among others. The facility too is crippled financially due to the delay in reimbursement of health insurance claims, both government and private. The pharmacy not so well stocked that patients would have to buy drugs outside. Also, there are other negatives of the facility where equipment tend to break down easily, and no ambulance service too is provided, where patients have to be referred to Konyo Teaching Hospital, the tertiary center. We are therefore using this means to seek for aid so that we can provide the best of care to our clients.
The hospital has 42 beds, comprising of 6-bed general female ward, postnatal 3 beds, antenatal 3 beds, and delivery room 2 beds. Male ward 8 beds, surgical wards 9 beds, children's ward 5 beds, and cots.
My name is Kofi Siaw-Larbi. I'm the nurse manager and a perioperative nurse specialist. So this is basically my office. This theater was constructed with the hospital since 1998, and we've been doing a lot of surgeries, from urology cases, with cesarean sections and general surgeries basically. Most of the equipment here were brought in since that time, and the theater and the equipment have not gone through any renovation. Most of the time the equipment have been maintained and gone through maintenance, but it keeps on breaking down, and we are not able to purchase because of financial constraints due to NHI, the National Health Insurance Scheme. There is delay in reimbursement of funds, which is crippling the facility. So as you can see, we'll be going around and you see most of our equipment. So we'll be very happy if you'll be able to purchase some or help us financially to be able to purchase and renovate those places to meet the standard. As you can see, this is our Diathermy machine, which is very old. It keeps on breaking down whenever we are in the middle of surgery, and it causes so much inconvenience both to the surgeon and to the patient because it delays the cases that we do. So we'll be happy if we get a new one. This is our anesthetic machine. We've used it for several years, as you can see, and we know there are very modern ones which has monitors attached to it, which helps in monitoring patients. But for this one, we lack most of the basic parts that will help in monitoring our patients. You can see we have a mounted theater lamp, which is also old, with a theater bed, which is very rusty at the joints that we can't even adjust it when we want patients to climb. The patient will have to stand on the stool before the patient climbs for surgery. So these are the basic problems that we have here that we wish you'll be able to help us.
The hospital does not have enough critical staff like specialized professionals such as critical nurses, dental, ENT, eye, urology, surgeons, among others.
I'm Ivy, a biomedical scientist at Siaw-Larbi. As you can see, our lab is so much under resourced. Even this machine we are using, hematology analyzer, doesn't belong to the facility. It's a hired one. So we are appealing for help. If you could help us with a hematology analyzer and also a chemistry analyzer, that will be of much help to us to be able to meet the needs of our numerous clients who depend on us for health care.
The delay in the reimbursement of the NHIS claims both government and private insurances are crippling the financial situation of the facility.
My name is Kofi Siaw-Larbi, the administrator of this facility. It was established for 20 years ago. I'm here for 15 years. And we face with so many challenges due to financial problems. Due to that, most of our clients are insured. Because that the government has not been paying our money on time, so we are finding it very difficult to run this facility. And most of our equipment are obsolete. The scan machine, the X-ray, is out of order for some time. The power supply here is very so bad that it has broken down our machines.
The pharmacy is not well stocked and it creates inconvenience to our clients by purchasing drugs outside. As a private healthcare facility, the customer care given to clients and the services provided determines the sustainability of the facility in the industry, especially with the introduction of health insurance. All health facilities should therefore strive hard to provide the needed care so that together the MDG 4 and 5 will be achieved. With advancement in medical care and innovations, we vehemently believe that with your assistance, we will be able to give the best care of our clients. Thank you.
We would be happy if you could assist us with the equipment listed below: anesthesia machine, diathermy machine, electrophoretic machine, microscope, theater bed, scan machine, X-ray machine, autoclave, blood bank fridge, PCR, that's polymerase chain reaction machine, blood gas analyzer, and ELISA. Please, you can contact us today or anytime on email sianlabihospital@gmail.com or address Siaw-Larbi Hospital, PO Box TA 28, Old Tafo-Kumasi-Ghana, or to mobile numbers: Dr. KWABENA Siaw-Larbi 0205 661621 or 024 2844312, or to Kofi Siaw-Larbi 020 91 28775, or to Sister Konyo 0244 774101. Thank you.